simple. I had sepsis throughout my body, and they found it, and they saved me.
Dr. Mendoza's here with the
I would not have a home if it wasn't for 1199. I would not have tried to stay.
That's true.
What are we doing?
That's true. We have nothing if it wasn't. Miss Powell, how are you?
Stay strong. Some water? 1199. We're with you. Thank you.
I was so blue and lonely too. You went away. How long you stayed to hold you dear and spread your love and live to mine.
February 7th, when the LICH board voted to close LICH, what did we accomplish? Every step of the way that they tried to close, we went to our legal channel and we prevailed. The workers prevailed every step of the way. Every time we go to the court, put back their attempt to close. So we have to celebrate for that victory. The Continuum gave LICH and SUNY Downstate a hospital that is financially stable. LICH inherited a very professional, highly skilled workers at LICH. What did they do? They mismanaged the hospital.
Yes, yes.
The workers, the patients in the community cannot be the people to suffer because the top SUNY Downstate board mismanaged our hospital. So it's right that we're doing what we continue to do, what we have to do, because at the end of the day, it is us that should really prevail over these big developers, big hospital executives that don't know how to run a hospital.
LICH save lives! LICH save lives! LICH save lives! LICH save lives! Party! Party! Party!
Thank you. Anyway, first off, let me first thank all the healthcare professionals that are here. I just want you to know that you are respected so mightily by residents of Brooklyn, all the nurses, doctors, and healthcare professionals, those that clean the hospitals, every one of you that play a crucial role, and nobody knows better than someone who's been in a hospital and depended on you for their lives. So I want the governor to hear this, and I want all of those that have to make the decision. Brooklyn is growing, not declining. We are aging, believe it or not. The fastest growing sector of growth in Brooklyn are the baby boomers. And therefore the demand for health care in the days ahead, especially where the growth of Brooklyn is, which is the area served by LICH, will be greater in demand, not lesser in demand. We've got some of the best qualified healthcare professionals that want nothing more than to do what they do to help save lives. So what does Brooklyn say to those that want to close LICH? Are you ready? Forget about it!
Forget about it! Forget about it! How about what we say? Party! Party!
Hospital. Governor Cuomo and the State Department of Health needs to take a deep look in the mirror. And this is really a moment of truth. This is a moment of truth. This is a hospital. This is the local economy. This is what the local neighborhoods depend on for 150 years to keep us safe, to keep us healthy. It is not a cash cow. This is not Long Island College Hospital is not a way to bail SUNY downstate out of their economic problem. This is a hospital.
That's right.
This is something that we depend on. This is something that we've worked for. This is something that this borough and this city has built up for generations, and we need to honor that, and we need to put in our resources and do the right thing. There's a right thing to do right now, and there's a wrong thing to do. There's a right thing to do and a wrong thing to do. The right thing to do is to save LICH.
Save LICH! Save LICH! Save LICH! Save LICH! Save LICH! Save LICH! Save LICH!
LICH has to stay. LICH has to go on and prosper and provide services for all of this area. And all I can say is thank you to everyone who's out here, our elected officials, and everyone else. We need LICH. LICH save lives. Thank you.
LICH save life! LICH save life! LICH save life! LICH save life!
Remember that advocacy is our greatest weapon at this time, and so we march. We march for justice. We march for health care, recognizing that health care is a right in Brooklyn.
I understand can walk to a hospital. Right. But if this happened to me again and LICH was closed, I might not make it to another hospital by ambulance. Right.
So fine, Lord, this thing that thing. I'm gonna kiss you sweet and fill you with sensation.
I'm here as someone representing Southern Brooklyn, Marine Park and NRC. The reason why I'm here is not only do I support the healthcare workers, but as our president said, this is not just a downtown fight, this is a Brooklyn fight. We have lost hospital after hospital, and we still have several hospitals that are in jeopardy. But I must tell you, it's not necessarily, possibly, but not necessarily because of this management. You know that the state of New York provides less Medicaid and Medicare reimbursements to hospitals in Brooklyn than they do in Manhattan. So with 80% of our patients on Medicaid and Medicare, only 20% have health plans. The state of New York is shortchanging our hospitals. So the money is not coming where it's supposed to be coming. So it's not just because, well, there's neglect or there's other problems. We're not getting the money, we're not getting the support. If LICH closes, this will have a ripple effect. In my district also, we have Brookdale Hospital that's in trouble, and there are other hospitals.
When I came to work over here, I only was 17 years and a half. And this hospital, I see them grow since the one little hospital to all this big hospital. And not only that I see them grow, I also see that we've been doing better job than any other place in this neighborhood over here in this hospital. Long Island College Hospital is a hospital. They always care. We always care for people.
We are fighting to keep LICH open, but this is a fight for Brooklyn. And this is a fight for people. This is a fight for rights, because health is not a privilege, it is a right, it is a human right. Let me say that also. We know that there is an economic challenge, but regardless of the situation, health should be priority number one. The government has the responsibility to provide the best medical care to the people. That's the reason I think that all of us from government, we should do everything that we can to keep LICH open. Save LICH! Save LICH!
LICH must stay open. There are healthcare cracks that are developing around the city. People need accessible healthcare. This is dangerous what's going on here. I've called, as a candidate for mayor, I've called for moratorium on hospital closings until a comprehensive healthcare plan is developed by the state and the city, because this is a travesty. Keep up the fight, and I'll be with you till the end. Thank you so much.
Everybody can start moving towards this way. We're going to get this part started.
All right. Thank you so much. We're going to go over there, but I also just want to shout out to 1199 and all the community groups are here.
So brilliant.
I am a registered nurse at Long Island College Hospital. I have been employed there for the last 30 years. I am also a community resident. I live in the Fort Greene area of Brooklyn. I am absolutely optimistic that this hospital, which has been open for more than 150 years, will remain open for 150 more years and on. We are all very optimistic about that. We have our community behind us, our elected officials, the staff is behind us. This catastrophe will not happen. It will not happen to the communities that Long Island College Hospital serves.
And till you whipped and fainted, honey, kiss me, sweet. I need some inspiration. I put your arms around me, in my eyes. Lord, if this one is you, kiss me now. I can't wait no longer. Summer, my love is growing stronger. You going on, I've known you for years. I can feel family here without gifting of you.
So we tell them, we are the nurses. Save your life, nurses.
Everywhere we go, people want to know.
People want to know.
See something like that, saying that the Sunni, they say that they want to close it down because they say they don't have no money. They're a bunch of liars. They have plenty money, not only for them, for us. If somebody do better billing in the hospital, we don't have this kind of problem.
voice heard. There is strength in numbers. We need to let the powers that be, Albany and Department of Health, we need to let them know that closing this hospital will kill people, that this is totally unacceptable, that this hospital is needed, and we need to continue to do exactly what we're doing. Remain optimistic, strong, and we'll survive.
The state spent something like $62 million for units. The state doesn't come in and give $62 million to subsidize a $1 billion real estate deal. That's not okay. Here's why we did it. We did it because we know that LICH is one of the cornerstones of Brooklyn healthcare. We know that LICH is a place where there are good jobs and good careers and make a difference for the community. We did it because we do not need this complex to be turned into more luxury housing, less community facility. We should not let LICH be sold off for parks. How do we feel about LICH being sold off for parks? Can the Chancellor Sunni hear you? Can they hear you in Albany? Together, we are going to stand, we are going to say, despite what's happening in Brooklyn, because of what's happening in Brooklyn, we need good health care, good jobs, community facilities. We need to save LICH!
Save LICH! Save LICH! Save LICH! Save LICH! Save LICH! Save LICH!
Yeah, so my daughter was just here a couple of weeks ago. Her appendix blew up, and I was talking to the doctor who took her into the ER, and he said, you don't know how close she was. Well, thank God LICH was so close. That's why she's still here. I look around, I see all the fine people that work at this hospital, all the wonderful nurses, and I think there's something that's being overlooked. Even if this works out and these real estate developers get this building, who the heck would buy one of these units?
Right.
I mean, you have to be out of your mind. To know what's been in there, you're going to buy a condo in that building? I had an idea. I thought maybe in the lobby, by the mailboxes where everybody gets their fancy shopping magazines and their credit card statements, they could put a picture of the NICU. So they would always be reminded when they go up to their big fancy bedroom with their view of the Statue of Liberty. That room used to have a bunch of little babies in it, hanging on for dear life, that were being looked after by some of the finest healthcare professionals that could possibly hope to do. Now, what I do for a living is extremely silly. Some people even argue it's a waste of time. But I don't know if there's a camera anywhere. But Governor Cuomo, if you let this happen, General Zod is going to be very mad at you, okay? Watch out. So downstairs, you let this happen, Van Alden's going to come after you, okay? Watch out. Watch out. You don't want to make these enemies. Trust me. All right, take care.
Save LICH! 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 Save LICH!
This nurse right here is the media here. The media here. My message is directed straightly and directly to Governor Cuomo and Dr. Shah. Governor Cuomo and Dr. Shah, our hospital, this emergency where I work with these fine people, we take care of approximately 60,000 people a year. Over 120,000 people in our outpatient clinics. Where do you think these people are going to go? The other hospitals, the other fine hospitals in the area are overburdened in their emergency rooms and in their clinics. There's not enough space to take care of the people if this hospital closes. Our hospital also has 40 beds that takes care of the mentally ill. Brooklyn Hospital doesn't have that.
hospital, God forbid, we got an emergency in Brooklyn or in New York, this is going to be disastrous. And that's the reason I'm here, to support all of those who are fighting to keep this hospital open.
Doctor. You know, one of the doctors from the NICU, Dr. Geyer, will be speaking next.
Okay, first of all, save LICH! Save LICH! Save LICH! Save LICH! My name is Dr. Alice Gordon. I'm the chief of neonatology. I represent that same NICU that this actor was talking about. I represent the nurses and doctors that take care of the mothers and the babies that come to LICH. I'm here to tell you that we have mothers asking me, where can we come and have our third and fourth baby? These people come to us and they come back, and they come back, and they come back. I was pleased to see Mark. Mark is the father of Emma. Emma is 1 pound 3 ounces. Emma is now over 3 pounds. Emma is thriving because of our care, and we need to continue that care. I would like to urge everyone here not only to call the governor's office, but to ask some very important questions. Who gains from the sale of LICH? I want names. Who is getting the money? Who is getting the money? If I cheated on my taxes, you would see me in orange. I'd be on YouTube. You know it was Dr. Garner. Who are the people that are trying to rob this community of LICH services? I want to know who they are. Everybody here, somebody here knows somebody who knows somebody who knows somebody who can investigate and expose these thieves. Investigate! 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 If I knew how to do it, it would be done already. But I don't know how to do it. I'm a great doctor, but I don't know how to investigate. But I got a big mouth. And I want somebody here to push the governor. In fact, where the hell is he? Where is the governor? Time. Everyone here, I'm so proud of you for coming out. I am so proud of my LICH family because everybody's out here and we ain't playing. Everybody keep up.
To save LICH. Save LICH. Save LICH. Save LICH. Save LICH. Save LICH. As a Red Hook resident, as a Brooklyn resident, we were hit hard by Sandy. We need to recover, and part of that recovery plan demands an emergency facility in this community. We need to save LICH. On Monday, tomorrow, when you wake up, please call the governor. All of you are connected to all the Facebook and social media. Call the governor tomorrow. This is a very important thing for the entire community, whether you live in a private home or in the Red Hook houses or wherever. Please make that your priority tomorrow. Save LICH! 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 All right.
I think it is not about Red Hook, it's not about a section of Brooklyn. It is about Brooklyn. It is about New York, it is about people, it is about half of people. And it is about a right. Because I believe that health, access to quality healthcare is not a privilege. I believe it is a human right. And in my opinion, and I think that government has the responsibility to provide the best quality healthcare to people. The same way we have the responsibility to provide the best quality of education to the children. It is the responsibility of the government. When you close hospital, you put in danger the life of people. And put it this way, people should be healthy to go to work, to provide for the family members, and to provide for themselves. If they become sick, they don't have the proper care, what's going to happen? They won't be able to work, to provide for their own family. and they won't be able to work also to pay taxes that the government needs. And what we're going to do is going to be a loss-loss situation.
We're almost done. They're at the end of the block.